Cancer remains a challenging problem. There will be over 1.5 million Americans diagnosed with cancer this year and over 600,000 Americans who will die from cancer. We need new and bold approaches to treating the disease to increase the cure rates and decrease the toxicities from the treatments that we have now. The Duke Cancer Institute was specifically set up to have these bold approaches to diagnosing, treating, and preventing cancer. One of the first bold approaches is simply the way we're structured, the way we're organized, both in terms of patient care and in terms of research. We are organized not by departments, not by what the specialty of the doctor is, but by what disease they're treating. So all the different doctors come together to take care of the patient. The radiation oncologist, the medical oncologist, the surgical oncologist work together in seeing the patient. So the patient only has to go to one clinic and see all of their physicians rather than having to travel around. And those physicians communicate with each other in taking better care of the patient. These different doctors and scientists work together in the research operations as well, so that we can develop the latest and the greatest novel approaches to treating this very difficult disease. So the way we're structured is breaking down barriers, and it's delivering both more effective patient care and doing more effective research. In addition, in order to make the discoveries, we need the greatest minds. We need not only the best physicians, but we need the best scientists. So we need great talent. We have great talent here at Duke. We take advantage of the entire university and the entire Research Triangle Park to recruit from around the country and around the world for the best scientists and the best physicians to make those discoveries. And the last piece that we need is to take our engaging structure and to take this top talent and to ask not the mundane questions, but the important questions. How do we cure cancer? How do we prevent cancer? How do we treat this disease in a way that not only has the patient survive, but has them survive without giving them the next health problem? How do we do it without harming their heart, without harming the liver, without harming the kidneys? How do we treat the disease in the most effective way possible? In addition to us working together within the Duke University environment, we also work together with colleagues around the Research Triangle and around the country. We are very effective at identifying those individuals and those scientists who can bring important new approaches to our ability to diagnose and treat cancer. For example, we have the College of Veterinary Medicine at North Carolina State University who takes care of dogs with cancer. And we have formed a formal partnership with them in order to use their patient care and their research to augment what we're doing in taking care of human patients and our human research in trying to figure out new approaches to diagnose and treat cancer. This is a relationship that we hope will benefit both patient populations, the canines with cancer and the humans with cancer.